All right, we are going to talk about some of the basics of giving yourself an injection, whether it's a peptide or NAD or glutathione. These are some of the foundational basics that you need to know. So to begin with, you're going to have a vial and it's probably going to have a cap on it. And that cap could either be like this, and that you would flick off in order to expose the rubber hub and draw it up. Or other vials like NAD will have a metal cap. So this guy's a little bit harder to get off. You could use your nail and flick it up. The other option is to use a butter knife or a pair of scissors, but you can see now I've got that up, and that's going to expose the rubber hub. In order to draw up the medications, you want to always sterilize the rubber hub with an alcohol wipe before you put the needle into it. And so when they've been in your refrigerator, before you get started to drop the medication, always just really clean these thoroughly in order to remove any bacteria. And those are ready to go. The other important point about drawing up medications is that you want to be very careful about not making the needle get dull. So when you draw it up, first of all, let me walk you through this little syringe. There's a cap on it, and then there's a second cap where you have the actual plunger. But back to drawing it up, I like to recommend that you have it on a flat surface and you go straight in. This allows you to do it in one puncture. Next, you invert to draw up the medication and then take the syringe out. So again, you want to make sure you have it on a flat surface. You're going in perfectly straight, one puncture, and then invert. And as you can see, as a solution is coming up in this small syringe, it should be filling the barrel. So you always want to check to make sure that it's filling the barrel. All right, so that's the basics. Now we're going to get into actually using your medication. Okay, so now we're going to walk through giving yourself an NAD injection. Of course, the bottle is already constituted, so it's already liquid, and it has a metal cap, which I've already removed. You could use your nail, you could use a scissor. Make sure that you expose that rubber hub. That's where you're going to drop the medication. We're going to take our alcohol wipe and we're going to clean that hub just to make sure that we're not introducing any bacteria into the medication. Again, we're going to open up our 50 unit syringe. We're going to take off the cap. There's a second cap on the bottom. And now we're going to go straight down and invert to drop the medication. So I'm doing 50 units. You may be doing 30 units, a smaller dose, but you could see the mark goes all the way down to 50. You want to make sure that your insulin syringe is the right size, because some of the syringes have 100 units and some of them have 30 units. That's fine. You just want to draw up to that 50 unit mark, and maybe the 30 unit syringe isn't big enough for you. Once I've drawn it up, I'm going to take it out and it's ready to be administered. When it comes to NAD, there's two options in the muscle, and I like to use our quadricep in the front, or you could use your glute, or subcutaneous underneath the skin, where we would use generally our belly. I like intramuscular because it's going to be absorbed faster and then you're going to see more energy and a quicker response. So I'll walk you through each, but the second option, the subcutaneous, you're going to see a longer duration of action and a little less intensity. So I just want to clarify the two before I show you how to do them. So we're looking at my quadricep. We're going to alcohol the area. It's always important to clean the skin first so that you don't have any bacteria on it, and you're going to go straight in. And then I'm just going to depress the plunger. You might feel it burn a little bit, and I'm not going to push the whole thing in, but if you were using the 50 units, you would press the syringe all the way in. And then take the alcohol wipe and massage the skin, and then you're done. Okay, if you wanted to do the subcutaneous injection for NAD, you're going to use an area where you have a little bit of loose skin. So typically we use the abdomen. You could also use the back of the arm. You could use the inner thigh. But I'm going to do like any other subcutaneous injection. I'm going to wipe the skin first. I'm going to pinch the skin. And I'm going to go underneath. And then you're just going to press it in. And then you're done. So So I like to take the alcohol swab and massage the area so that it gets absorbed and prevents any signs of bruising. And that's it.